So recovery from joint replacement is really becoming really quite rapid. We are really, as we progress with the management of people around the time of surgery, getting away from narcotics and all of these other kind of medicines that in a lot of ways really slow people down. But it's not uncommon for people to be home the same day after a hip replacement and to require only Tylenol for pain control. And of course they take some other medications as part of our multimodal strategy for pain control. We treat people with nerve medications and anti-inflammatories, but we try to stay away from heavy-duty narcotics because those have all sorts of negative side effects with them and just slow down the whole process in general. So it's not uncommon for us to have people go through the whole process with a very controllable, minimal amount of pain. And the anterior approach to the hip really does facilitate that and makes that much easier to manage people around the time of surgery. As far as recovery after surgery, I usually tell people, if you're home the day of, that's great. There's really no magic within the first couple of days. All that we really care about is just getting the incision to seal up and that we're not having any immediate troubles. People are, moving around the day of. You'll do steps before you leave the facility, things like that. So we certainly don't want you to be bedbound. We want you to feel comfortable to move around. And a lot of times people even feel better right after surgery because their arthritic pain and the condition that they showed up with, which led to surgery, is so bad that they feel better immediately. You just trade that discomfort for a little bit of surgery pain, which starts to get better consistently every day after surgery. I usually tell people they'll be really pretty good in the first few weeks. Usually people are back to work, if not sooner, but usually by, say, 4 weeks, 6 weeks, depending on what kind of stuff they're doing and their physical demands. They make the bulk of the recovery in the first 3 months. And then people continue to even show improvements even for a year, year and a half after the operation. What I usually tell people is that while your hip starts out here, it's normal, and it starts to go south over years and years, it's not like you have surgery and then just go back to normal. These two graphs, where you'll be when you're recovered and where you started before it started going bad, those two graphs look the same. So you make compensations for years with the bad hip, then you get it fixed, and then you start to work out all of those compensations as you continue to make progress and get better after your hip replacement.